The decisions doctors face with dying patients are not often addressed in medical school.
Ricky is back in the hospital.
Dr. Gomez wants his first-year med students to start thinking now about how people die and the issues they will face as doctors.
He's intermittently lucid, but really not very well focused. I don't think he is in so much pain as he is delirious. His liver is basically shutting down. And Rose is there with him, his wife. He will probably die in the next 2 or 3 days, is my guess. He's not getting food, he's not getting water. He's simply getting pain medicine and something for his delirium. So the question is,
hey, Ricky.
What am I doing for what purpose?
How are you?
If I felt that we could sustain Ricky's life in a way that he would want it sustained, this case would be entirely different. He says that he's ready to die. Now the question I've got is, what am I going to do with IV fluids and nutrition? What am I trying to accomplish? What is his wife trying to accomplish? I think
the students hear from Dr. Gomez that he's no longer providing fluids or nutrients to Ricky Tackett.
It just seems to me that that's almost assisted suicide.
Why?
Because, I mean, water and food is just such a vital part. I mean, obviously you have to have it every day. And it just seems like that's the same thing as taking away medications. I mean, you're taking away what he needs to live.
The level of responsibility that a physician feels about end-of-life decision-making.
Susan Goins-Epley, a university chaplain, teaches this ethics class with Dr. Gomez.
You're saying, if I remove hydration, then I've done something that's going to hasten his death, and you feel responsible for the fact that this man is dying. And you're not. He's dying because he's sick, and there's been a lot of intervention in between when he started to die and when he's going to die.
I don't seem to have much of a problem with withdrawing ventilator in a person in his condition or other cases that we've discussed, but especially hydration and somewhat nutrition, I feel a little uncomfortable with that. And I understand if it's going to be an invasive procedure where you've got to put in, you got to put in a central line, you got to put in a feeding tube, all those things. I understand not doing that because that's invasive action, but the hydration seems like something you can do.
I will bet you that if I hydrate him or try and hydrate him, most of the fluid is going to go into his legs and his lungs because he doesn't have enough oncotic pressure in his vascular system to hold the fluid in.
At least at this stage of the game, you feel like you're training to preserve life. Where you're learning everything that works in the body, and that's your goal. And you know that that's dying as part of it, but facilitating it or even accepting it, I don't, I know you have to learn to deal with it somehow, but it's not something that comes right away.
Okay. So if you want me to explain...
Dr. Gomez holds off another night, trying one last time to fine-tune Ricky's pain medication. It still isn't working.
Last night, he doesn't know what he's doing, and he got both hands trying to break my arm. And so I'll step back and let the nurses do it. Maybe I'm agitating him. And I actually laid the cot out in the bathroom and tried to lay in there. And I had to watch them try and use the restraints and hear him scream. And it was like we have broke horses. And it was a whole lot like trying to break a wild horse. You know what I'm saying?
I do know what you're saying. I don't think it's pain that's causing his agitation. I know he intermittently complains of pain. I'm not sure that that's what's doing it. I think it has to do with his liver failure.
Okay, so Ricky...
I can do almost anything I want as a physician to try and sustain his life, and I will ultimately fail. If, on the other hand, the goal is more modest and different, and it has to do with accepting the fact that we are all mortals and that there is something, in fact, absolutely natural about the fact that we die and that people whom you take care of as their physician are going to die, then it begins to raise all sorts of different questions. Not that the hydration question isn't important. It's actually very important. And if you feel a little morally queasy, which is what I think you're saying, I think that's a good thing. You should feel a little queasy. You should feel a little uneasy. It should make you think twice about what you're doing. These decisions should never be automatic or pedestrian, because they're not. They involve the life of another human being. Ricky was really clear with me that the one thing he did not want was to go out in pain or suffering. He was just very I mean, you heard it, I'm sure, many more times than I did. So Dr. Corman and I have talked about it, and I think this is probably the best solution. I want to sedate him, but sedate him continuously rather than the Ativan. Every few hours, I want to put him on something that is like Ativan. It means that there's going to be no more waking up. Okay, even for the delirious stuff, that won't be there.
Yeah. I would welcome that.
You would welcome that.
He doesn't want to be this way. And that was his greatest fear, was having. He knew with liver failure, the death you had to die. You know.
Well, you don't need to die that death. Let's let him rest, let you rest. All right. All right?
The decision to increase Ricky's pain medication and withdraw fluids and nutrition invites death through the door.